Hi, everyone. Welcome back. We're now heading into our last session of the day, and we're really pleased to have two gentlemen with us for a conversation on being released amid COVID 19. Katti again will be the discussant, and she'll introduce our guests, Tommy Green and Edward Scott. Welcome to both of you, and we'll go till about, I would think, about 4:15 or so, and then get everybody out the door. Thank you, guys. Welcome. Katti?
Hi. Thank you, Mr. Green and Mr. Scott. That's the only time I'm going to call y'all Mr. and please call me Katti. Thank you so much, especially you, Edward, for filling in at the last minute because Mr. Powell couldn't be here. This is an easy conversation and it's aimed at knowing the lived experience and the story of folks who are coming out amid COVID. Let me go back a bit. Tommy Green is the lead community health worker for the North Carolina formerly incarcerated transition program. He co-owns Success While in Transition, which is a reentry project. And Edward is co-founder of the Wounded Healers Reentry Project. And he has his side note is Edward is that he was released 2 months ago, I'm presuming from pretrial detention from jail. Yes. You
Oh,
can
no, ma'am. 6 months ago.
6 months
Yeah,
ago.
yeah, been 6 months. Yes.
Okay.
June the second. June the 2nd.
Okay. So let's just start here. What are y'all seeing on the ground in this moment? Certainly among people who are being released right now, but also people who are still incarcerated, who may be trying to be released. Tommy, you want to?
I let Tommy start it off.
Okay.
Yeah. So in a nutshell, pandemonium. To be honest with you, guys are getting released. So when dealing with this population of people, one of the hardest things to help these people with, and one of the biggest hurdles that they have to face, is housing. And coming out in the middle of this pandemic, housing is like super hard. Most of the organizations that would normally, assist and take people in, they're shutting their doors on them. The shelters they've doubled down on their restrictions. I mean, it's just a lot, especially dealing with housing in particular. But and outside of that, just fear. These guys, especially the guys that are getting released early, that were not even prepared to come home to a certain extent, as if anyone can ever really truly be prepared to come home after dealing with incarceration. But add on the fact that some of these guys are not prepared to come home, and then they come home in all this panic and all these new ways of living, new ways of life for everyone. So it's pandemonium right now.
Before we go to Edward, what new restrictions have shelters imposed, and are there restrictions strictly to do with formerly incarcerated people?
So it's not nothing that they've imposed that strictly deals with formerly incarcerated people, but they have their social distancing parameters that they have to follow as far as how many people they can house in a certain particular space. For example, in Orange County right now, the actual men's shelter has been shut down, and they moved all of the residents that were there into a hotel. They got them all rooms so they could separate them or whatnot. And with that being said, space is limited in the hotel. Like another great example, one of my clients now that was recently released, the guy that was going to be here before that they kind of canceled on us or whatever. We was like a few minutes almost short of him sleeping outside because just the shelter had no room for him when he came home. Luckily, I was able to make a connection with our local reentry council, and they sponsor him at a transition home in Durham. But had it not been for them, that guy would have been stuck. I'm sleeping in the streets. And one of the things that the shelters have, they have this like I think it's called a white flag policy or something like that. So whereas they would provide space for people when the temperatures drop below freezing, which now that's what's going on. The temperature dropping below freezing. But from my understanding, and I could be wrong, but I'm pretty sure they're not honoring that right now because they just don't have the space.
Edward?
Yes, ma'am. To my understanding and to the information that I'm getting from the prison system, from guys that's still incarcerated, that I know that the spike of COVID has risen in the prison system, especially at Orange Correctional Facility. As I said earlier, I left June the 2nd, and before I left, the COVID wasn't that bad, but now it has risen. A lot of guys that's still incarcerated at Orange and all over North Carolina is getting. But Tommy said something about a white flag, but in the prison system, it's a red flag. It has been allowing us to know from the guys that's incarcerated that it has been real terrible now because of it's no space. It's everybody's in one little area, and it's hard for them to really do 6 feet apart. It's hard for them not to be able to interact with each other because they're in there all day. So, and with that said, they had stopped the early release, and that has made it even worse. And then you got the COs that's coming in with the COVID, and they're not getting tested. They're just coming in to work, and they passing it over. Then they got other guys that's being transferred into the different prison facilities, and they passing it on. So it has been real terrible in the system now. It has risen real bad.
Were you released early? Were you released under some special conditions amid COVID?
Yes, ma'am. I was released June the 2nd of this year due to the COVID, because they was trying to make room for and follow the guidelines of 6 feet apart, but they have stopped it now, and it's getting terrible in the system now. They're not releasing nobody no more, it seems like.
So I want to ask you a few things, Edward. What was the length of your incarceration, this last one, and why were you there?
I was excuse me, I'm sorry. I was given a life sentence, a Class C life sentence for second-degree murder. I have been incarcerated over a period of 30 years. Due to the COVID, I was just recently released. As I said earlier, I stayed at Orange facility for 7 years. I have formulated a great support group right along with Tommy and others who has helped me be able to establish myself here in Durham facility, Durham County. I'm a peer support specialist. I have done a lot to be able to prepare myself for this new journey that I have embarked on.
Would you tell me what COVID looked like while you were still incarcerated? What sort of safety precautions you were taking, what you were equipped with? I hope we didn't lose you. Edward, are you still there?
Yes, ma'am, I'm still here.
Yeah, what you were equipped with to ensure or not?
When COVID first hit Orange Correctional, we was told by the superintendent that we'll be giving masks, and they will be coming into the dorms and moving beds around to try to make space. They tried that. Evidently, it didn't work because, as I said earlier, a lot of guys has been affected with this COVID. But you was able to get 3 masks. You had to wash the messes out yourself. They moved bunks around to prepare for this COVID before it really got worse. But evidently it didn't help out at all.
They were cloth masks?
Yes, ma'am, cloth masks.
And so what did you wash them with? What did they supply you with? What was the hand washing routine? What was the linen washing routine? All of that.
Okay, you had to hand wash your own mask. They told us that you had to wear it 3 days and then hand wash it, which I think was unsanitized to be able to do that because you have nothing really to wash it with. So you really washing it with hand soap that they give you to wash your hand at the sink when you use the bathroom or something like that. So that was unsanitized to me. They never gave us the opportunity to be able to use the washroom where they wash clothes at for us to go out on CV passes or work release. They told you had to wash it yourself. They did not equip us with any type of soap to be able to clean our masses. So at first it was difficult to be able to be in the midst of that disease or that COVID when it first came out, but we was preparing ourselves. Us, the guys at the camp, was preparing ourselves to be able to approach this situation, and we was doing what we supposed to do, as staying our distance, going outside here and there, interacting with each other. We was doing all the work that we supposed to do, even though they was telling us to do that, but we was making sure that we didn't catch it, and we were making sure that we took our responsibilities for ourselves, not just because they told us. We want to do it ourselves. We wanted to be safe and healthy.
So, and this is for both of y'all. So in this climate, Tommy, you're a community health worker. What are the mechanics of your job right now? What are you doing day to day in terms of steering people, including those who have come out amid COVID, into healthcare? And we'll talk about jobs and housing as well. But as a community health worker, what is the nature of your work right now, and how has COVID changed what you do?
So the nature of my work is connecting guys that are formerly incarcerated, that have a chronic condition, to free healthcare through Piedmont Health Services in Chapel Hill. And I also help the guys make certain connections to help them overcome other obstacles they may face, like jobs, housing, things of that such. One of the more pivotal jobs that I had before COVID hit was I was given a county car to help provide transportation for my clients. Out of the things that they have to face when coming home, next to housing, jobs and transportation is like the next two things that they really struggle with and really need help with. So with that being said, once COVID hit, I was kind of grounded from any type of contact with any of my clients, any physical contact with any of my clients, and for good reasoning, because again, all my clients have chronic conditions. So that means automatically, if they're infected by COVID, they automatically are going to deal with comorbid situation or whatever. So with that being said, the best course of action was to have minimum contact with them. I've had zero physical contact with all of my clients since COVID has started. I do still go to the clinic on their days, because that's one of my jobs as well. I'm kind of like an advocate for them and the healthcare providers. So I do show up doing their clinic visits, and I still, have minimum contact, keep safe distance. We always wear masks on and so forth. So with that being said, my job's kind of been a little bit more challenging, because I've had to try to figure out how to help these guys navigate these systems virtually. And again, dealing with this population of people, that's another thing that you have to really be aware of, that these guys coming out, all of them are not tech savvy. A lot of them are not tech savvy, so that's challenging in itself. So essentially right now, my job is, again, everything is virtual, everything is Zoom, everything is by phone. I make all the connections that I can with them via the phone, email, so on and so forth, corresponding with the other organizations that I refer these guys to. Sometimes in certain situations, we'll even have Zoom if they really just need to have a face-to-face with me. Because sometimes, again, dealing with my client, my caseload, my job can consist more of counseling sometimes than actual field work. So sometimes they just need to talk, or they just need to vent. That's why I say that's why I can say confidently that COVID has really caused pandemonium and put this population of people in panic, because again, they already had uphill battles to fight. I have clients that, doing right when this thing hit, some of them were just getting on their feet, just getting jobs, and then the job shut down, or they get laid off, so on and so forth. So now they're back to square one. So again, it's my job with dealing with them has kind of been all over the place as well. But again, all zero contact, and it's for their benefit, of course.
Sure. Before I move to some of the journalist questions, I want you to dig in just a little bit. So you were talking about Piedmont Health Services, and I know there's a patchwork of healthcare for people coming out of prisons and jails, depending on where you live. So what's going on in North Carolina? Do they have a discharge plan that has connected them with healthcare before they go, before they're leaving? Tell me about how that works.
So, and I'm not, and I don't just say this just because, I work for FIT or whatever, but right now, as far as connecting people coming home from incarceration, connecting them with healthcare, FIT is one of the leading organizations that's doing that. We actually, as a response to COVID, we actually started a program called FIT Connect, whereas anybody that was released because of COVID, they consider them, I think the term is ELC, extended leave of confinement. Yeah, I think it's extended leave of confinement. But anyway, so our response to that was FIT Connect. And what FIT Connect does, we were connecting anybody that came home because of that to their local healthcare providers. We went ahead and set up their initial appointment, so on and so forth. So that was one thing that we did as a response to COVID or whatever. And again, so essentially, as far as connected healthcare, guys coming home from prison to healthcare, I really don't know any other organizations besides FIT that's really doing that. Now I will say there are some organizations.
Statewide, this is not standardized across the state.
No, this is definitely just definitely North Carolina. We were actually modeled behind another organization called the TCN Network out of California.
Yeah, is that the Transition Clinic?
Transition Clinic Network.
Yeah, Emily Wong, their co-founder, was one of our panelists. Yeah.
Oh, got you. Okay, yeah, great lady. So so FIT was kind of implemented behind them. So with that being said, they're kind of like the leaders or the forerunners of making this type of service available for the formerly incarcerated. But it's slowly trickling down to North Carolina. The FIT program actually has are in 5 counties now: Mecklenburg, Wade, Durham, of course, Orange, and Guilford.
This question is for you, Edward Scott. It comes from Victoria Law, who's a freelancer. She asked, given that many other states' releases were to people with nonviolent convictions, was there any resistance by politicians or victim rights groups to your release or the release of anyone with a violent conviction?
To my knowledge, no. A lot of us who has violent crimes, right? We enter into the Department of Correction with no direction, but we're leaving out with direction. So with that said, a lot of stuff that we have done while we was in prison has helped us to be able to enter into society again, with a focus, with a direction. And most guys who have violent crimes are not prone to go back quickly as guys with non-violent crimes. For what I have seen, so many guys with violent crimes are staying out here or doing what they're supposed to do, getting help when it comes to the FIT, or getting help with other organizations that's directing them and helping them to be able to stay out here with the resources to be able to help them develop a new life.
Edward, how old are you?
I'm 53.
Do you have any illnesses yourself that put you at risk for COVID or extra risk for COVID?
No, ma'am. No, ma'am. I have, when I entered the Department of Correction, I began my change, whether it was physically, mentally, or spiritually. So I have took care of myself since I've been incarcerated, prepare myself for this day.
Okay. All right. This next question is for Chandra, I'm coming back to you. This is still for you, Edward, and there's a follow-up as well from Victoria. So this question is from Francisco Castro. He's a freelancer. He asked, what's been the most difficult part of transitioning out of prison, and how has COVID complicated that transition?
The most difficult part of COVID for right now, at one time, well, I'm not gonna say for right now, but for one time was getting my license, because you had to go through so much red tape to be able to get your license.
Your driver's license?
Yes, ma'am. You got to make appointments. If you miss your appointment, you got to make another appointment. Sometimes you got to wait 2 or 3 months for you to be able to make an appointment or another appointment if you miss your appointment.
Go back a little. You have to go through a special process to get your driver's license.
Yes, ma'am. You got to call in to DMV. You got to make an appointment. And then if you miss your appointment, you got to make another appointment, right? And when you don't have no license, sometimes it's hard for you to get to the destination unless you're able to connect with people like Tommy and other groups that are able to take you there. So if you have an appointment and you have no type of interaction or no type of network, then you're in trouble. So for me, it was kind of difficult because sometimes I might say, well, I need to go ask somebody to make this appointment, or I could get Tommy, but Tommy might be busy, or I might get somebody else, he might be busy. So it was kind of difficult, but I made it. But I'm just saying it was difficult sometimes to be able to get my license. Then I get there, I might fail the test. Then I got to take it over. Then I got to make another appointment. So that's part of the difficulty that it was for me because I need my license to be able to find work. I mean, so that was kind of difficult for me, but I made it happen though.
Are you working now?
Well, since I've been out, me and a friend of mine named William Elmore, who's also a business partner with Tommy, has started a landscaping business called Community-Based Landscaping.
Okay.
And what we are trying to do is we're trying to create jobs for guys who's coming out of prison that need help, that need that support, that need that network, the same type of network that we needed while we was in prison. So we're trying to formulate more organizations to be able to help people who is coming out of prison right now.
Okay. Hold on. I'm jostling through this list. This one question is from Chandra Bozelko, who's also a freelancer. Has anyone, do y'all know of anyone who've received disciplinary reports for contraband for PPE, personal protection, whatever that E is, stands for, making their own mask or gloves? If so, how often does this happen? And I'm presuming Chandra knows somebody. I shouldn't make a presumption. I'm a journalist. Do y'all know folks who've made their own stuff and gotten into trouble?
Incarcerated or out here in the world?
Incarcerated.
Okay. To my knowledge, I have not known anyone while I was at Orange who got in any type of trouble for making any type of masks or nothing like that. I'm not saying that is not possible or did it not happen, because it could have happened. But since I was there, nothing like that never happened.
Okay.
I actually have a client, to be honest with you all, I had a client that made a joke about that. And it kind of like flew over my head until you all just brought it back up that maybe the joke was real. But we was having a conversation and he was just mentioning about, how rough things was in there and coming out here. And then when he reverted back to talking about being inside, he made the joke that he had got in trouble. He said he got in trouble for tearing up a shirt or something to make a mask because he had lost the mask he was given or something like that. And when he said it, I honestly we was having a casual conversation. So I really didn't take it seriously, but maybe so. After hearing that question, I didn't know that was even a thing, for lack of a better way of saying that. But yeah, I had a client that did bring that up.
And this question is for both of you. Have y'all any thoughts on how the design and layout of prisons and presumably jails should change to prevent outbreaks of this kind in the future, but also don't isolate persons? This is Kelly Davis. She says here she's in California, and San Quentin, she says, has tried to move people from dorm style areas to solid door cells, and many were resistant because it meant they would be cut off from fellow prisoners who provide support and friendship. Can y'all address that?
Well, for me, in my stay in prison, I truly believe that it shouldn't be like that. I think that if you're not at risk for COVID, then you need to be able to interact with people, because that gives you the help that you need to be able to reach out to other people for networking. For example, when I was incarcerated, I met guys like Tommy, Will Elmore, and other guys, Darrell Clayton, other guys who was in position to be able to network with people on the outside, who also was great help for me, because they introduced me to the same people that helped me in my transition. So I think that the guys that that do need to be together, especially guys who is trying to do something within their life, who trying to make a better life for themselves, because everybody don't have that support in prison. So people need to be around each other, unless you're a COVID risk or unless you got COVID, then it's different. But if you don't have COVID, I truly believe that people need to be together in prison to help each other that's on the same path, because everybody not on the same path in prison.
Tommy, I want you to go back a bit. How many clients are on your caseload right now? Is that typical? You had mentioned their comorbidities. So what kind of diseases do they have? And what's sort of the age range of these people, if you would sort of paint a profile of that population?
Yeah, sure. So my caseload right now is 75.
Just by yourself?
Yes, by myself. Yeah. But see, when I know people eyes get really big when I tell them the size of my caseload, but my caseload is broken into sections. I have red clients, I have yellow clients, I have green clients. The green clients are my best clients, the ones that are case plan compliant, so to speak. They're on a regular medication regimen. Many of them have even moved. Some of them have even moved on, meaning they moved out of my county, or they got a job where they have health care benefits now, whatever, so they don't go to Piedmont no more, things of that such. And then my yellow clients are more the clients that I would say like at risk, but they need a little bit more case management. I would probably check in with them a little more frequently than per se the green clients or whatever. Usually touch base with them. Some it will range from maybe once a week to once a month. And then my red clients are my high risk clients, the clients that are battling substance use, the clients that have more serious medical conditions, the clients that need close monitoring. I definitely make sure I check in with them every week, things of that such. So with that being said, looking at it in that aspect, my red clients, I probably have about 20. The yellow ones are around 30. So I have pretty much maybe between a 40 to 50 active caseload right now. So, and the age ranges, I have clients as young as 30, around 30-ish, early 30s, and some as old as mid 60s.
Go ahead. I'm sorry.
No, I was just gonna say the more common conditions that they have, a big majority of my caseload battle substance use, has substance use disorder, or a mental health disorder.
What mental health disorders?
Mental health conditions. It ranges from schizophrenia to depression, PTSD, a lot of depression, of course, and PTSD, of course. Other conditions that are kind of high, Hep C, Hep C, diabetes, high blood pressure, and it's one more that I do see a lot. Blood pressure. I'm sorry, I'm trying to blank right now, but those are the typical ones I deal with.
No worries. How many of your current clients were released during COVID?
About my last, so just this past 90 out of the last 90 days, I've gotten about 4 new clients. So that's 4. And before that, I have 3 early release clients. So that's 7. And I think about 2 or 3 more that were released earlier this year during COVID.
Sure. I have another question from Victoria Law, and it is, do either of you know how many people with violent convictions were released early because of the COVID pandemic? So even if you know sort of by example or anecdotally, but if you know if there's some official data on that where you are?
Not really. No. The people out of the cases that I've seen that were released early, honestly, Scottsdale is probably the only violent offender I've seen released early within the last, the last 6 months since he's came home. The rest of them have been kind of low level, a lot of drug cases. And no, I'm sorry. It is one other guy that was kind of like in the same position as Scott. So a lifer that, you know, came home or whatever. I think he was actually incarcerated for murder too.
So I have a couple of questions, and the bigger one is this: what is it that people who've never been incarcerated don't get about the experience of being formally incarcerated, and particularly being formally incarcerated and trying to navigate this world? And this is for both of you, what's grossly understood about yourselves, about your clients?
How long do I have again?
Take it.
So in a nutshell, I think what's the biggest thing that's most misunderstood about this population of people, well, really it's two very big things that I think people don't really realize about formerly incarcerated people, especially people that have been formerly incarcerated for a significant amount of time. And the first one I think is the psychological ramifications that come from being incarcerated. Everyone knows that there are some, everyone knows that this is real, but I don't think people really take it as seriously as they let on. And what I mean by that is that I notice a lot of times with this population of people that people are not very patient with them, with dealing with them. And my thing is and when I say not patient, meaning short with them, nasty with them, not understanding when, you know, sometimes they have that, they might come off as angry or bitter or so on and so forth. But what people fail to realize is, I'm not saying that anger or bitterness is justified, but at the same time, you have to remember that you're dealing with a person that was honestly treated like an animal for years. So now you take a person, you put them in that chaotic atmosphere, and then you take that person in that chaotic atmosphere and you bring them back to where they came from. And you expect them to still be the same as when they left, when it's no way possible. A person is definitely never going to be the same, that the same way they were when they come home, they're never going to be the same once they're released from prison. Even myself, I have my particular situation. I was incarcerated for almost 12 years. You know, I came out, I've done, you know, fairly well for myself. I have a very good job, so on and so forth, great family, great wife, everything. But at the same time, I recognize that I still have demons that I fight, that I battle. Not necessarily anything is wrong with me, but at the same time, you know, I was incarcerated for over a decade. You know, that's very traumatic. Luckily, you know, I got the right wife, I'm in the right family, I got the right support cast to help me in my journey into this in transition is what we call it. Because essentially, even though I've been home 5 years, I'm still in transition too. I'm still getting used to some things that I wasn't used to before, or, you know, I'm still trying to adapt to certain things that come with being a formerly incarcerated person, and the pressures and the stigma that's attached with that, you know. So with that being said, that's one thing. People just gotta be more patient with these people. Yeah, that guy might be a little bit short, or a little short with you, or a little bit nasty with you, or so on and so forth. But still, be more understanding, because he's dealing with a lot. You know, not only is it already a lot to even be incarcerated and come home, but it's a lot to put your life back together after those circumstances. So, and then the other thing is, I know, and a lot of people are not. I'm not gonna. Well, it's hard to explain. I'm just gonna say this for the second one. I would say, just it's almost similar to the first one. Just be more. How can I say it? I would just more empathize with these people a little bit more, if nothing else. Put yourself in that situation. You know, I think that's the key to treating these people with a certain respect, or giving these people the support that they need. Put yourself in that position and treat that person how you would want to be treated if that was you down on your luck, or if that was you trying to put your life back together.
Edward?
I look at it like this: everybody makes mistakes, right? So with that said, I'm gonna talk about myself. Since the first day of my incarceration, I have been making a lot of changes in my life. And I have been making a lot of changes, not just for myself, but for my family and for my network, the people that's there for me. So with that said, I think the best thing that ever happened to me is the connection that I have been given through the grace of God of the people that have came into my life has helped me and with my direction, with my transformation. So with that said, a lot of people don't understand that a lot of people that's in my shoes have became a product of their own environment. Not saying that, or I'm not trying to use it as an excuse, but at the same time, a lot of us fall under peer pressure, and we get caught up in this system, and we allow the system to take control of our thinking, our movements, and with that said, we get caught up in doing whatever we have done to come to prison. But at the same time, we are still you have good people that's in prison just needed the help to be able to find their self. So a lot of people that have not been in prison don't understand that that a lot of people that's in prison, right, have fell victim to what was going on in the streets, and the first thing they do is judge, but they don't realize that anything could happen to them. They could have been caught up in the same type of situation, but they didn't. But how can we judge a person who went to prison and not really know that person? You can't judge a book without reading the whole book. So I mean, as like Tommy said, I mean, we have to be more understanding. We have to be more patient. We have to be more open-minded that people make mistakes. And with that said, I mean, we have to be able to help these people when they come out of prison, to help them with their direction, help them with their transformation, to help them reacclimate back into society with the resources that they need so they won't go back to prison.
Okay, so one last question before I let y'all sort of do a wrap up and tell us the stories you think journalists ought to cover. And it is this: how your range of your clients, Tommy, how are they paying for healthcare? What are their copays, et cetera? And also, because I would imagine it does vary by person. And Edward, for you, what is the cost of your healthcare right now?
So that's one of the greatest things about the FIT program. Right now, we cover all their co-pays and prescription costs, except for in rare cases when it's like specialized care or specialized something that they might need or whatever that's a little bit too high for the budget that we have. That's when we kind of still make the connections to other organizations that might help with that. Primarily, UNC. Charity care is like a kind of like our go-to thing for people who have a cost that's a little bit too high for our budget.
Okay, Edward, question to you.
For me, I was kind of blessed, as I said earlier, and as I said numerous times throughout this demonstration that I have been trying to give, is that I have been blessed to be able to be connected with different organizations who have helped me with my my health care. Right now, I just got my Medicaid card. I was able to apply for food stamps. So I think that the best thing for a person to do that's incarcerated is begin to work before they get out. To find these organizations that can help them with the resources they need to be able to have Medicaid, to be able to get food stamps, to be able to get job researches and stuff like that. So I mean, I have been blessed because I didn't start when I got out. I started when I was in prison.
Mm-hmm. Where do you live now? What's your housing situation, Edward?
Right now, I'm at Straight Talk Transitional House. And Straight Talk has been a great, and I'm sorry for not even mentioning Straight Talk, but Straight Talk has been a great support network for me because they have helped me also with job research, Medicaid. Matter of fact, they've been a great part of me getting my Medicaid. They've been a great part of me getting my food stamps and stuff like that to be able to survive out here. You know, when you leave prison with nothing, and be able to come out here and get these things, that's a great start. That's a great push. And a lot of people are getting that. So I want to be one of the ones who be able to help other people coming out, whether they females or whether they males, and point them in the right direction because they need these things. Because if we don't help them get these things, then they're going right back to what they was doing before.
Thank you so much, y'all. I am, y'all's contact information is going to our journalist. Just so you know, they'll be in touch. Thank you so much. This has been really rich. Appreciate it.
And
Thank you,
Katti.
guys. Thank you, guys,
Katti.
very much. I'm so happy to be a part of this.
Well, speaking on behalf of all of us, we really thank you and appreciate your achievements, both of you that you made, and thank you for the time you spent in talking to us. So
Thank
it's
you.
been great talking to you. We're going to wrap up today's session now. Just a few housekeeping notes. First of all, I want to thank Katti, of course, and Michael Gelb for their help in backstopping all the stuff we've been doing. And I appreciate your patience in sticking with us over the technical glitches that we had a little bit earlier. Chris Graham, our producer, is now back on stream. And we hope at our next session, which is a week from today, December 9th, it will be a little bit easier, a little bit more streamlined. The next session, you'll be using the same URL that you used to get in to this one, so don't lose it. Just mark it somewhere. We'll post as many of the links as we can get from the chat room on our conference page site so you can have them. And as Katti said, we will put together all the contact lists of all the people who spoke today for your benefit, and we'll either circulate them or put them on our website. So once again, thank you all. Stay safe, keep well, and we'll see you next week.